Hi everyone. Hi, my name is Sean, and me and Alick will gonna do discuss about shoulder dislocation for early or ADP 130 injuries assignments. The shoulder is really important in our life. Um, I found out this is a really interesting topic because Alick did exercise assignments with Alex in Lewis's class about shoulder exercises, and for me, my father had shoulder injuries when he played baseball. So what happened was he kind of threw the ball in the outfield to the home plate, and because he kind of threw in an awkward position, he loses balance and he fall on the ground. Eventually, um, he had to do some injuries because he got a severe shoulder dislocation in his right shoulder, and which is his dominant hand too. So um, yeah, he got a severe rotator cuff injury, and that that leads to his retirements. So he ends his career of baseball right there. Um, and it's not just for my father, but for other, sports people or just like me. Imagine if you can't use your shoulder properly. Shoulder does everything. You can write something when you want to write something, you're flexing the shoulder, or if you want to pick up something, you're extending or you're flexing the shoulder. And like if you want to throw the ball, you will need some kind of motions in your shoulder. So basically, whatever you do with your hand, it depends on your elbows and shoulder. So I just want to ask you guys, have you guys ever have any experience with shoulder pain or injury? If you had before, you kind of know what shoulder dislocation is, or if you don't have any experiences, it's okay. We're gonna discuss about shoulder dislocations. So yeah, bear with me, and we're gonna start on what's the definition of injury. Sorry, dislocation. So there's some objectives. Okay, so now I'm gonna talk about some anatomy of shoulder. The shoulder is made of the clavicle, humerus, and scapula. It is covered by synovial joints, ball and socket joints. Consists of humeral head and glenoid, which is the reason why I call ball and socket. Consists of where they meet at the ends of the bones covered by articular cartilage. Glenoid is covered by a strong fibrous cartilage called the labrum. So the labrum adds stability and cushions to the joints. And also covered with ligaments. The shoulder muscles can move freely in any direction, which is multi-axial, which cause a lot of injuries in shoulder, including dislocation. So as you can see in this picture, there is humerus, there's clavicle, that's scapula right here, and here's the synovial joint, and it's covered with articular cartilage and ligaments. So it's basically the ball and socket is kind of stick together. So what is shoulder dislocation? So the definition of shoulder dislocation is an injury where the top of the humerus move out of its normal position, either partially or fully. So if you see this picture, it just explain it's normal here, but that socket is, that ball is kind of out of the socket in anterior, which means that socket is kind of out of the ball, yeah, in forward, and posterior means basically your ball is kind of going pop out of the backwards. So this guy has anterior shoulder dislocations. As you can see, there is some prominence in acromion, and is slightly adducted, and also you can see there the heights of those trapezoids is different. This is way lower. This is kind of higher. And you can see here, but elbow is slightly flexed inward. And those in X-ray, as you can see, those bones are popped out of the socket, which is the end of humerus. So that's X-ray for shoulder dislocation. So etiology, why do shoulder dislocation happen? It happens because of excessive amount of force of external rotation and adduction at the shoulder joints. At 90 degrees in both abduction and external rotation, ligaments cannot hold and stabilize the glenohumeral joints, and the head of the upper bone is completely popped out of the glenoid socket by excessive force. So the muscles are overwhelmed and unprepared. Yes, quick reminding here. If imagine if you hit somewhere, there's a wall here, and you were running, and you kind of see the other way, and your shoulder is kind of popped out of the back way. So that's posterior dislocation right there. So there are a lot of excessive amount of force in your shoulder that cause shoulder dislocation. So next. So why shoulder dislocations happen, and what types of activities or happenings should happen for dislocation? So it happens when you had sport injuries, such as baseball players, basketball players, or swimmers who use a lot of shoulder. It can happen when you have car accidents or traffic accidents, traumatic. So if you have whiplash, your shoulder is kind of go forward and backward. That can cause your shoulder dislocation. And a fall in your shoulder or outstretched arm. So if you're falling somewhere, your shoulder is first hit and then it's kind of backward. That can cause shoulder dislocation as well. Seizures and electric shocks, which makes the shoulder muscles contract and palpate to pull out the shoulder joint externally over 90 degrees. There are some more risk factors: repetitive overhead movements, instability of ligaments in shoulder by repetitive motion, especially overhead movements, just swimming, basketball, and baseball. So if you throw the ball repetitive for just like a baseball pitcher, there's more chances to get an injury in here. So that's why a lot of baseball pitchers have some surgeries when they play for a long time, and usually the reason why they retire is because of the shoulder stability is kind of weak, and they can't practice more repetitive. There's more risk of having shoulder injuries or pain. So another risk factor is previous dislocation. The first dislocation can stretch the tissues surrounding shoulder joints, causing shoulder to be unstable and easy to reoccur. Genetic. Some people have less stability in shoulder joints when they're born. And this picture explains about, so his name is Corey Bellinger. His home run in championship from last year, and he had high five with someone, and accidentally he kind of blew up his shoulder in the backward, and it ends up with him. He had to do some surgeries, and it was kind of severe. So he kind of regret what he did in Game 7, and yeah, I mean, it's just high five, but he lose his shoulder. So basically, shoulder dislocation can happen whenever in your daily life. So be careful. So there are three different types of shoulder dislocations. It's usually divided according to the direction in which the humerus exits the joint. So they are anterior most common, posterior and interior least common. Anterior is 97% of shoulder dislocation occurs, and humerus is popped out of the glenohumeral joint towards front of the shoulder. There are lack of ligamentous support and stabilization, um, contour in deltoid, severe injury can cause rotator cuff injury, and also there's some prominence in at the end of the shoulder joints. Now we have posterior, which has only 3% of shoulder dislocation. It's due to external blow to the front of shoulder. So that means you're kind of blow to the back. It usually appears to be abducted and internally rotated. Less percentage of having contour deltoid, prominence humerus, the same as anterior. You may have concurrent tearing of labrum or rotator cuff. Happens when you fall with pronated hand on the ground. So imagine if you high five with someone and you're kind of, you know, breaking your shoulder in the backwards. Okay, so from now on, I'm done with chatting, and the Alick will cover the left of sessions. Thank you so much.
Some areas affected are the shoulder joint capsule, which is a group of ligaments that encapsulate the shoulder ball and socket joint, which connects the humerus to the glenoid or the shoulder socket. It also affects the long head of the biceps, the superior and middle glenohumeral ligament, and the rotator cuff, more specifically the subscapularis. The acromion, axillary nerve, radial nerve, and median nerve are also affected, and the deltoid loses its normal contour. Some signs and symptoms of anterior dislocation include the arm being held in an internally rotated position and an abducted position. The shoulder also looks flattened with an anterior prominence in the acromion, and the humeral head is anteriorly palpable. You can also notice swelling, numbness, weakness, and bruising. There's also limited range of motion in the shoulder joints for mostly every movement, and the elbow is slightly flexed. Some signs and symptoms of posterior dislocation include the arm being fixed, internally rotated, and adducted. The posterior shoulder also has an acromion prominence. Just like the anterior dislocation, swelling, numbness, weakness, bruising, and a slightly flexed elbow are also signs and symptoms of posterior dislocation. Here's a picture of someone with a dislocated shoulder may pop back on its own, but you can use a method called closed reduction, which is putting the ball of the upper humerus back into the joint socket without surgery. But usually, it's more practical to rush to the emergency room for medical attention, which may be painful, but it should stop when the shoulder joint is back in place. For following treatment or rehabilitation, you can immobilize in a sling or other device for a few weeks. You could also apply ice to the sore area for 3 to 4 times a day to relieve some symptoms. But instead of applying ice directly to your skin, you should apply crushed ice to the injured area over a thin cloth and should be applied for no more than 15 to 20 minutes at a time, waiting at least 1 hour between icing sessions. You can also do gentle toning exercises and weight training to restore range of motion and to prevent dislocation in the future. If rehabilitation is not working or shoulder dislocations repeat, then unfortunately the surgery might be needed. And that's it. Thank you so much for watching. Here are some references, and here are some photo citations. Thank you. Some areas affected are the shoulder joint capsule, which is a group of ligaments that